post-concussion syndrome. That occurs when symptoms of a mild traumatic brain injury persist longer than expected after that injury, and symptoms include like headaches and dizziness, problem with concentration and memory. Here to discuss how you treat that and how do you recognize it, Corewell Health's multidisciplinary approach to post-concussion treatment. You got speech-language pathologist Emily Buteyn. Hello, Emily.
Good morning.
Good morning. And physical therapist Shelby Myers. Hi, Shelby. Shelby and Emily, thank you so much for being here. Let's talk a little bit. I mean, it's hockey season, it's football season. We're hearing a lot about concussions this time of year.
Yeah.
How does a concussion happen? I mean, what's happening inside the body?
So most people have probably experienced a concussion with like a blow to the head. And most people think about, sports injuries, car accidents, falls. But we also see people who have had injuries from just something falling on their head, whether it's at work, shutting their car trunk on their head. And so their symptoms can linger past 2 to 4 weeks, and that's usually when we term that post-concussion syndrome.
Yeah, so we actually call it a mild traumatic brain injury.
Okay.
And if you were to go get a brain scan, like a CT or an MRI, it's common for it actually not to show up on the scan. And so we have these people that come in and they say, I'm experiencing all these symptoms, I don't feel normal, and I can't figure out a cause, so what's going on with me? And so it's nice as our role, we can kind of validate that and say what you're going through is real, and we're here to help you with that.
That's got to be maddening to have no results, nothing show up on a scan or something like that, but to still have the symptoms.
Right, and that's why they actually call it like a hidden or an invisible disability. It's very common for it to be called that because you look fine on the outside, but you don't feel fine.
And what exactly happens when a concussion happens? I mean, what defines a concussion?
It's complex. The brain kind of shakes inside the skull, and there's kind of a cascade of things that can happen with whether it's inflammation, your blood-brain barrier is disrupted, structural changes with the neurons of the brain. But usually those things can resolve relatively quickly, but symptoms still remain, even though your brain is healed.
Right. So these symptoms, and that's where this multidisciplinary approach at Corewell, that's what you guys are all about. So
correct.
Can you each discuss what you're a physical therapist? Start there. Obviously, I don't know, we can't do physical therapy on the brain, can we?
We can retrain your brain. So from my role as a physical therapist, we try to separate concussion symptoms into 3 realms: cognitive, emotional, and physical. Physical symptoms could be headaches, neck pain, whiplash type things, dizziness or room spinning vertigo. You have a decreased tolerance to exercising, so I can help out with all of those things.
And then from a speech therapy side of things, I typically target that cognitive area, those thinking skills. So things like word finding, thought organization, memory, concentration, problem solving, all those things that you would need for those complex daily activities like managing your schedule or managing medications or managing your finances or grocery shopping. So
my aversion to exercise has nothing to do with concussion, but I understand that's an interesting side effect that people might not even know.
Sure.
And this is just 2 what other categories? I'm sure you're multidisciplinary here.
Right. So we have occupational therapists on our team too, and a lot of them are vision specialists. So if you're noticing it's difficult for you to focus, that could be vision related. Dizziness could be coming from your vision as well. Your eyes might not be tracking well, so it can be hard to scroll on your phone or get through your computer a whole day on your computer. So our OTs are specialized with vision training. I can do a little bit of that as well as a physical therapist and the rest of our team. And our OTs, they even do things like driving simulator practice to get you back on the road if you're not feeling comfortable with that. So, yeah.
But it's important to note that all of these symptoms do interact with each other, and so they don't stay in their own buckets, is how I describe it to our patients. So like if you are experiencing difficulty visually focusing or difficulty with balance, that's taking a lot of brain and thinking power to compensate for that, which is then in turn going to impact your cognitive skills or potentially result in stress or sadness or anxiety.
It's all connected.
It really is.
The anxiety goes up, the stress goes up, it's hard to get back to work, take care of your kids. It can be a lot.
All right, so if you're experiencing any of these symptoms, it might be a concussion. I mean, even though it happened a few days ago, you bumped your head and you may not be realizing something's going on up there. So giving you guys a call might be a smart choice. So where can people, here we go, there it is. You want to learn more, or maybe you seek some treatment. Boy, that room spinning vertigo sounds awful. I mean,
definitely get to us right away.
Corewell Health, patients can use my chart as well. Go to spectrumhealth.org for more information. Thank you so much for your time this morning, ladies.
Yes, thanks for having us.